Hi everyone, we're back again here for another Tech in 10. My name is Ryan Duffy.
I'm Tommy Heffernan, and today we're doing drying off cows, Ryan.
Yep.
So off we go, 10 minutes. Drying off cows, our first introduction to each other actually was around milk quality and mastitis many years ago. Sorry you ever met me. But here we are talking about drying off cows. So kind of three key phases: preparation, procedure maybe, and post drying off. So we think about why do we dry off cows? What's the purpose?
Well, we often call it the holiday for the cows. You're essentially letting the mammary gland rest, and subsequently the cells will rejuvenate and they'll be ready to go after a period of time for the next lactation. So they're going to come back a wee bit better than they were the year previously, hopefully.
People often ask optimum time of dry period length. I would say around the 60-day mark is kind of key. Body condition score, metabolic health management is separate, but that period of 50 to 60 days is kind of key, isn't it?
Yeah, it definitely is. If you're going a wee bit longer for, say, cows with chronic mastitis or anything like that, you do have to be very careful, as you said, about metabolic issues. If you get over fat, you're going to be prone to ketosis, milk fever, all of those. So always take that into consideration if you're extending a dry period for an individual animal for whatever reason.
It's a good time for your body condition scoring to be done at that key point of drying off. Why drying off? I suppose the cure rates, and it's a great time to get infections under control. What when we talk about cure rate and new infection rate, what are they and what are our targets?
Yeah, so the whole purpose of drying a cow off with an antibiotic is to cure an infection. And what you want to be getting is a hit rate of, you have it up there, of 85%.
Or plus.
Or plus.
Yeah.
And that is a wee bit more challenging with some pathogens, but it is achievable in a lot of farms. Then you have the new infection rate, which is the subsequent lactation. You want it less than 10% of cows calving down with mastitis, less than 15% of heifers calving down.
So these are ones that have picked up in the drying off period. And we talk about the procedure, it's the real risk time for that. Okay.
The definition of that is eating over 200,000 cells per mil.
Okay, brilliant. Right, so preparation, we can work off, we need data, cow list, you have some things there. Whether we go blanket or selective dry cow therapy, there's a lot of talk about selective dry cow therapy. A lot of people are doing it. Some people lost a little bit of confidence. It's something we still need to consider and think about. Some farms require blanket. Again, work with your own vet. But what kind of key things do we need to be thinking of coming up to drying off?
Going back to what we've already discussed in the last few Tech and 10s, It's all about preparation. Getting that last milk recording, it can be a wee bit challenging to get it all fitted in with a number of management things going on, and even trying to get people to milk record for you. So planning that 4 to 6 weeks out before you're drying animals off is very important. So I'd say 4 to 6 weeks out for that. Identifying the pathogen you have on the farm, it's good for your farm to know what it is, but it's also very good for your vet to know what antibiotic, what pathogen, what's the real epidemiological challenge that's actually occurring on the farm. So any cows that have clinical mastitis, and I've been harping on about this for years, take the sample, put it into the freezer if you're not going to send it to the lab. It can stay there for 4 months.
Okay.
So if you have that going on throughout lactation, you would have these guys in the freezer ready to go to the lab right now. If you don't have that done, any case of clinical mastitis, take it, send it to the lab. Try and get 4 or 5 of them good and representative. If there's no quite clear-cut clinical mastitis, just take a sample from all 4 quarters and send it to the lab and identify if it's staph, strep, or E. coli. So we should be doing that now, again, 4 to 6 weeks out to try and get stuff to the lab and get the results back that we can actually action on it this year.
Okay. You've a few other things, teat score, clip tails.
Yeah, teat score, I'd say do that 3 weeks out. And there's not really much you can do about it in respect if you have bad teat scores at this stage, but you can try and plan as to how to make sure that your new infection rate does not go up as a consequence. So if you have poor teat scores now, you know to get the machine serviced during the dry period and to keep an eye on as to why it actually went awry this year. Clip the tails 2 weeks out. I don't like doing too many jobs on the one day. And this is a very dirty job, so do it 2 weeks out. It makes life a lot easier drying cows off. There's no.
Would you singe udders at that stage as well?
Oh, singe udders, yeah. If you have
the capacity to do it.
If you have the capacity to do it, and if your cow's mammary glands have hairy udders, and then a week out, that's when we should really be talking about reducing yields by putting animals onto a maintenance energy requirement.
We're talking about shifting them onto hay or lower amount of silage, or a straw and hay, a silage mixture.
Yeah, at least taking the meal down to less than 2 kilos a day. Ultimately, you want animals be less than 9 litres, producing less than 9 litres a day, which is quite a challenge.
A lot of people struggle with that, and even if your cows are at 15 or 20 litres, you're still going for abrupt dry off. So you're going to literally dry them off abruptly is kind of key. Lowering it down doesn't work, doesn't?
No, you have to do it abruptly. It's been shown time and time again that it's far better to do it abruptly.
Okay, so you have to be pretty dramatic with dry matter intake reductions there. Look, the procedure itself, we probably should have done this over 2 videos, which was your suggestion, in fairness. But
he never listens.
The procedure itself. So we're going into the teat with either antibiotics and teat seals, or teat seals in their own, or maybe external teat seals. But we're not going into external teat seals, but it is a real risk for introducing infection, isn't it?
Yeah, like it's not a sterile environment, even though a lot of people probably think that it is. There is a microbiome in there. But if we start introducing any sort of pathogenic organism, it's only going to corner us. And the more and more important selective dry cow is becoming, and even with blanket dry cow, if we introduce something and we can't cure it, we're kind of cornering ourselves for next lactation before we've even started it. So really important to be hygienic.
The thing is, I have dried off cows. It is most people fear it out of all the jobs of the year. They hate it. It's very hard work. It's very messy. It's hard to do. So give yourself time and get help, because if you rush it and introduce infection, could potentially have big impacts, knock-on impacts for the next lactation again, and particularly with selective dry cow therapy. And scrubbing the teeth. So if you look at the 4 teats like this, so if you're coming in from this angle, start on this one, 2, 3, 4, so you're not cross-contaminating that teat.
Yes.
Simple tip. But scrub. Gloves and loads of alcohol.
Has to be spotless. I would always say double glove. If any feces gets on you, just take one glove off. It has to be spotless. Clean them this way, and then apply your internal teat sealant or your antibiotic, or both backways.
Okay, because often what the antibiotics has done is allowed us to be a little bit careless at drying off. Where you're going for selective dry cow therapy without antibiotics or even external teat seals, you really need to be careful on hygiene. Having large cotton wool lumps to make it easy to clean, those Ziploc bags, and having a tray. But time and help, they're the key things. Time, help, and hygiene. It's easy for us to say it on a whiteboard, but I have dried off cows. It is a really hard job, and it is worth spending a bit of time. And even if you're doing selective dry cow therapy, Ryan, as well, I would always say there are some cows, even with low cell count, that have physical anomalies on their teats, or there might be leaky cows. They may still need a seal or an antibiotic if they're at risk, aren't they?
Yeah, well, that comes back down to getting advice from your vet. Like there is TASA funded mastitis investigations or drying off. So definitely getting that sort of advice. If you have a lot of teat end damage, chances are you're going to get a lot of new infections. So I would be inclined to think that in a lot of circumstances, antibiotics would be appropriate in that certain circumstance. So
okay,
exactly what you're saying.
First 10 days post drying off is a real risk period. First 24, 48 hours is a real risk period. If you're seeing a lot of leakage in cows, okay, you can go in and reseal and stuff like that. I tend to, I think when you see leakage, you be very careful about intervening. If you are cows at a high yield, you can see a little bit more leakage, but that's where your abrupt drying off and reduction of dry matter intakes is really important. Even having cows standing after milking for 25-30 minutes helps, but a clean environment that they go into, really key. Any thoughts on post drying off?
Yeah, well, just to go back to what you're after saying, say this is our dry period. The biggest risk period for new infections are the first 2 weeks immediately after we dry off, and the 2 weeks as coming up the calving as animals start to bag up and we start getting leakage and stuff like that. So if we're really hygienic here and very, very focused on hygiene here and here in the sheds, it's really, really key. Like if we do a really good procedure and we put leaking cows, maybe not even leaking cows, into cubicles that aren't fantastically clean for those 2 weeks, we're in bother. Particularly if we're moving them on to silage. We've talked about how it can take a week to 2 weeks for the microbiome to really kind of accommodate that dietary change. We don't want a lot of loose feces around here, and if there is, we need scrapers going 68 times a day, particularly during those 2 weeks and these 2 weeks.
So that's where you extra lime in the cubicles for the first week or two after twice a day, maybe 3 times a day liming. It's that type of thing. So preparation, Procedure itself is absolutely key, and protection posted is anything else you'd want to add there, Ryan?
No, I think we've covered a lot. We know that the big risk periods are here. We know that this is really, really important. So please,
Done. 10 minutes.
done.